So we have now our next presentation. It's truly a pleasure for us to have with us um, Maria
Well, then,
Fusco as the
I believe,
second. Yes.
Romero, I think we're going to take a quick 5 minute break and start up at 9:20.
Oh, okay. Okay. Great. Great. Excellent.
It's a 4 hour marathon we're in. We'll get
Yes.
up, stretch our legs.
Yeah. Sounds good.
We'll resume at 9:20. Sound good?
Perfect. All right. Thank you, everyone.
And Maria, would you like to just flash test your slides, your
All
presentation
right.
real quick?
Yes, to make sure.
Yeah. Okay.
I'm seeing them.
Oh, good. Okay.
Yes,
Awesome.
seeing them. Very good. Thank you, Maria.
You're welcome.
All right, we'll sit tight, get up, stretch your legs, grab a
Okay.
swig of water. We'll get going at 9:20.
Good seeing you, Maria.
Good to see you too, Keith. How are you doing?
Good, good.
Good.
Great. I hope everyone had a chance to have a quick stretch break. I know it's 9:20 currently. Um, and we are truly privileged to have with us our next speaker, Maria Fusco, to talk about a very, very interesting topic. Something I'm very interested in history, and like to enjoy visiting various museums. And so this is a very interesting topic. And so to give you a brief background on Maria Fusco, she's been a chief conservator since 2016, following 5 years as an associate conservator, and she's overseeing the conservation laboratory at the museum's Avenir Foundation Conservation and Collections Resource Center. And her background includes a Bachelor of Science in Biology from UNC at Chapel Hill and a Master's in Textile Conservation from the Textile Conservation Center at the University of Southampton in England. And she has worked as a conservator at institutions across the world in New York and Denmark, and finished a fellowship at the Los Angeles County Museum of Art and a Samuel H. Kress Conservation Fellowship at the Smithsonian's National Museum of African Art. And so she's really been able to expand the conservation department's role as an international resource in textile collections care. And so it is truly my great privilege to introduce. Please join me in welcoming Maria Fusco.
Thank you, Romero, for that nice introduction. I appreciate it.
Yes.
And I hope that my dogs and cat and daughter are quiet during this, so I apologize in advance if anyone has
No worries.
an outburst. But yes, I've gotten to know Chris and Keith at Hopkins, and I'm really honored to be here. I learn a lot whenever I join the presentation series they put on, and so I hope I can offer something of interest to everybody. So hopefully you can see my slides here. My name again is Maria Fusco. I'm an art conservator, and so it basically means I take care of collections. I treat things to go on exhibit. We do research on collections as well. And so I'm just here to talk to you today about a bit of risk that we face, a little bit on physical risk, but more chemical risk, because that's more tangential to the point here. The museum I work at was a private museum for about 90 years. And then we became part of a university, George Washington University, about 10 years ago. So yes, my presentation is on museum, sort of occupational health risk, but I'm going to touch on some broader topics as well. So to be a little more exact, I'll be speaking about occupational health, as well as public health concerns related to cultural heritage. And, you may ask how cultural heritage materials are relevant to toxicology. I'm going to cover that and explain also what professionals and community members are at risk in our spheres. I'm going to go over what our concerns are as we can identify them, and what we're currently doing about them in our professional communities. Occupational health and safety has been a big focus for our museum over the past 3 years, and so I'm going to add some details on that as a case study. And I'm going to try to wrap up with areas where occupational, environmental health, and safety professionals can get involved in general, and especially toxicologists, as those of us working towards safer practice are getting more familiar with, say, industrial hygienists as partners. So far, though, we're less familiar with occupational physicians and toxicologists, but I'm hoping, at least for our sake, to change that for our museum. So first, I want to define a couple terms I may be referencing: cultural heritage and material culture. So cultural heritage can be objects that you can touch, but also intangible attributes that are part of culture as well. So this will touch, especially, I'm going to talk a little bit about tribal communities as well, and Native American communities. So those of us in the museum field are trying to educate ourselves to expand our minds a little bit, that cultural heritage goes beyond just the tangible objects. But the tangible objects we talk about are often material culture, is another term for them. Tools, utensils, machines, art, building, the whole gamut of things that a culture produces to kind of survive, to document that they were here, to express themselves. Here, our risk in our community is really related to these material culture objects, to their care, to their display, hazards created by the maker's practice. So sometimes heavy metals were used in making practices, but also treatments, conservation treatments that were undertaken in the past by collections caretakers, and they may leave harmful residues. So I wanted to begin by sharing my experience as a snapshot, both to kind of relate the variety of daily and yearly risks that we encounter in cultural heritage, professions, but also to illustrate how many of us in this field begin to get interested in safety issues, and that's usually via our own personal injury. So first listed are physical hazards, of which we encounter a lot. I'll just touch briefly on this in this presentation just to kind of give you a full scope, but I'll focus mostly on the chemical stuff. So just in my current profession, I've been at this museum for like 14 years. And in the first 2 years at this one job, I was carving an ethafoam mount for a hat. The blade slipped and I cut my finger and had to go to the ER. My second year, I tore my rotator cuff and bicep tendon moving boxes by myself. The field is persistently understaffed, so often we are doing solo tasks like this, even when we know better. At my third year at this museum, I had a pesticide exposure while I was pregnant. A colleague was humidifying textile objects, so getting creasing and wrinkles out through a cold contact method in a separate room. But we believe some organic pesticides had been applied to this object, and when they were sort of volatilized, it was humidified, they were volatilized more. She became sick, I became sick. We got headaches, lightheaded. And that really started me on my journey of research because I was pregnant and I wanted to find out what was going on. And I spoke with people in the health and safety community to figure out what kind of risk I had faced. Pesticides often were applied in the past, proximate to or directly on textile, paper, natural history collections, amongst other type of media to prevent pest damage. And just this last October, I had an acute reaction to a proposed collection donation, a 19th century rug. My eyes began stinging and burning just only when I was in proximity to the object. When I stepped away, I was fine. We didn't end up accepting that donation, but it could have been the remnants of a past cleaning residue, or it could have been a past pesticide treatment. So this is just one staff member in one job at one museum. So, I admit I'm a little bit clumsy. That may be a factor here, but it kind of does just highlight the risk existent in our museum working environment. And in the example where I was exposed while pregnant, it begins to illustrate one component of a public health risk. So professionals working in cultural heritage are also mothers and fathers, with the potential to carry home residues we encounter on our clothing. And as I'll share shortly, cultural heritage objects do not exist in a vacuum. Practices of collecting items of material heritage of our or other cultures have in the past led to collections preservation methods which create chemical risk. And so one example is the pesticide treatment I mentioned. As collecting material heritage begins to be revisited in the wider museum community, returning these materials to their home communities is taking place, repatriation, which in part can spread risk, even with good intentions. So given the wide swath of professionals, community members, and the public that come into contact with historical materials, a colleague, our conservator, recently characterized these pesticide residue concerns as a public health crisis, and I agree. So museums may seem erudite, sort of like sterile environments, but unfortunately it's far from the case. In preparing objects for storage, we rehouse and build storage mounts. In preparing objects for exhibit, we treat objects and build display mounts. We need to use blades, power tools, including saws to building these mounts. We sometimes work at heights to install mounted objects. A little more relative to toxicology, in researching material composition and maker practices, we may use instrumental analytical tools, some of which employ X-rays, UV light illumination. In treating, cleaning, or repairing objects for exhibit, we sometimes use chemicals. This varies amongst media types, and here we try to increasingly make conservative choices, but we do use solvents at times. Sometimes we don't have a choice about the chemicals we interact with. One example is the pesticide residue on collection objects scenarios. I'm going to focus more on this type of hazard in this presentation because that's what I know more about. And in some conservation practices with some media, particulates are an issue. So here at our museum, bottom right, making metal mounts. But some conservators work with media types such as stone, ceramic, metal. Cleaning them can also introduce particulate risk. So it could help to start with whose safety we're worried about. It's a mix of professionals, community members, and even the public. What professionals in cultural heritage exist and what do we do? It tends to be the people who are art collections and historic collection centric who are the most exposed to risk, at risk from these collections themselves, from processes needed to care for them and to use them to educate. So sometimes collections are used in public programs. In increasing cases, risk in directly using these objects, because in cases where important items were taken from cultures without their permission, or when they were in a position where they had no place to object, objects are being repatriated, and there's understandable desire to interact with and use these objects of cultural patrimony. The way a museum views an object is often fundamentally different than the maker or the community that made it views it, and more on that in a moment. The top right are some staff in museums who are most collection centric. So most museums have educational collections as well, which are used to teach and may be accessed by the public. They're often populated by objects which were not accessioned but still held, so they weren't accepted into the main collection. Not all curators, collections managers, conservators, art handlers work in institutions, though. Many run their own private practices or consultancies of one or a small group for hire. They are equally or sometimes more so at risk. They work with private collectors, small historical societies, and they have less of a safety structure, less institutional support. There are other groups on the front line, so to speak. And this is an area I'm only beginning to learn about. I'm not an expert, but it's important to spread the word and make you guys aware as well. Repatriation may be a term you have heard of. In the US, an act of Congress in 1990 called NAGPRA provided for the protection and return of Native American human remains, funerary objects, sacred objects, and objects of cultural patrimony. And this was an act that was passed, 30 years ago, but a lot of museums are still working to become NAGRA compliant. And in addition, there have been sort of updates to the NAGRA policy as well, which encompass an even wider swath of cultural patrimony. Within and beyond the legal requirement to repatriate cultural patrimony, there is an increasing recognition of the ethical need to do so. So processes of shared stewardship and voluntary returns exist in this area. So a voluntary return is when a museum, a university, a library, other institutions proactively return cultural belongings, human remains, sacred objects to Native nations and communities, even when they're not legally mandated to do so. It's ethically driven. There's another concept and term, shared stewardship. So this is the concept that in advance of communities receiving back cultural materials, or in some cases instead of repatriation. So if a community is not quite yet ready to receive back an item in the interim, a collaborative relationship should exist between the tribal community and the institution currently holding their cultural items. They make decisions together on care, management, and interpretation of the cultural materials in ways that honor both tribal sovereignty and institutional responsibility. So when we consider pesticide residues in particular on cultural objects and they're returning home, we have an obvious health concern to communicate on. In terms of, on the right side of my screen, in terms of who may be receiving and handling and using returned cultural patrimony, there are a range of groups and individuals as listed on the right. So again, this is an area I'm still beginning to learn about, but I want to introduce this as more professionals and beyond this community members need consideration. So there are tribal museums as well that have the same collections-oriented staff as in non-tribal museums, and you see familiar job titles here, the top right. There may also, though, be administrative groups or groups which include community members who receive and manage these objects or who have a stake in the process. So these would be a TIPO officer, a tribal historic preservation office within some nations. Sometimes there are community curation teams where it's a mix of individuals, community members, and the professionals from museums. Some tribal nations might have a cultural resources department that may be a larger entity which encompasses a museum and a TIPO office. So the point is there's a mix of possibilities, and you want to be aware of who to seek partnership with as well if you are repatriating objects. Sometimes when the original maker of an object can be identified, an object may be returned directly to the family, and the family may want to use the object, understandably. So you can see the how risk is spreading here. The health concerns inherent here are of concern to the museum community. And there are efforts being made to mitigate risk, to communicate risk. And as mitigating and communicating risk are what OEHS professionals do routinely, we're seeking more engagement in those communities. Let's see. So I introduced some of our health and safety concerns more broadly, but now I want to get into a little more detail on those concerns. And they fall into these categories, in my opinion: physical risk, chemical risk, instrumental risk. And I'm going to focus more on the last two, as I think they're more relevant to your concerns and your expertise. Physical risk, just to go over very briefly, what we might classify as safety. We carve FFL mounts. This is an archival quality hard celled styrofoam to make small internal supports for objects. We carve down fiberglass mannequins and dressmaking forms to display historical costume. We use saws to cut storage tubes, use saws to cut exhibition hardware like cases and platforms and sand them. And all of these, may be, there may be an exposure to inhalation of particulates that may be a factor. Particulates can also be encountered when cleaning stone, metal sculpture, also though when excavating artifacts and processing them. So we partner as conservators a lot with archaeologists, and there are some conservators who are called archaeological conservators who basically work with an object right as it is taken out of the ground. But when you are excavating, you're potentially exposed to particulates, and then when you're cleaning those freshly excavated artifacts, potentially exposed to particulates as well. So silicosis is something that an epidemiologist colleague of ours is starting to open our eyes as well to as a risk in our field. And silicosis isn't talked much about in our field currently, but it should be. So I hope that begins to change. We also use chemicals, so solvents in treating, which is cleaning or repairing objects, and applying or activating or removing adhesives. These are instances where we make known chemical choices. And these choices have become increasingly conservative over the years. So less noxious solvents are used. And we learn in programs or graduate programs, we learn how to store our chemicals safely, how to retain SDS sheets and consult them, how to dispose of chemicals properly. However, a troubling source of risk is in the unidentified chemicals we sometimes, or in the case of our museum, often encounter. Chemicals that are complex to identify, sometimes impossible to identify, often expensive to identify. And here I'm talking about pesticides, inorganic and organic, and more on this in a moment. But some of us also work with taxidermy collections, which have the potential to expose us to heavy metals, because heavy metals were used in the taxidermy process, basically. So anytime you're working with fur, or we are working with fur, animal hides, we know to kind of look out for heavy metals as well. So maker practice, and then later conservation, protective practice as well. We also research our collections objects to attempt to understand and answer questions about what something was made of, which might lead us to know when something was made or how. Here you might be trying to understand the internal structure of a composite object, or identify a pigment, a paint, or a dye, or identify an inorganic pesticide residue. So we use analytical instruments for this. Some common ones employ X-rays or UV illumination to identify their material components. So we're exposed to these things too, but we're gaining knowledge in safer practice here as well. And that leads me to how good are we in the museum field at being aware of mitigating these health and safety concerns, and it varies. Physical hazards, I highlight physical hazards that we're not often well trained on this in the museum environment. There's generally little to no written or training guidelines. It's often less on our radar as a source of risk. Conservators who work with metal, stone, and who work to process excavated materials, in the past have not always looked to PPE, personal protective equipment like respirators, to manage risk, but this is changing, especially among younger professionals. Chemical hazards are a little more on our radar just because of our training, basically. In our graduate studies, we do a fair amount of chemistry usually, and we have to take an organic chemistry to get into our programs. we use chemicals in treatment, for example, as I've said. In program, we generally get some lab safety training, but once working, we get varying degrees of kind of a safety structure. Some places you'll have no support at all. If you work at like a university or for a federal state entity, you might have a safety department you can go to for help. We have some experience in chemical storage, retention and review of safety data sheets. We have some health and safety groups as well, increasingly in our national professional organizations. But many of us who work on textiles or paper or natural history collections will also encounter unknown chemicals in the form of pesticide residues, and there are real long-term health consequences and building engagement on this topic within our community from museum staff. And indeed, there's a need to engage in this topic relative to repatriation and a duty for care and communication of risk. There's not always fulsome coverage in training programs at all, though this is changing slightly. And despite efforts in the late 1980s and 90s by museum health and safety pioneers such as Nancy Odegaard of the University of Arizona and Marilyn Poole, they did a ton of amazing work, but things kind of fell by the wayside a little bit, and there has not been significant process beyond the great measures they undertook until recently back in museums. But even with recent progress in trying to test collections, a lot of time our safety responses kind of stall out in testing. We don't know how to get beyond that stage. We get crippled by the volume of information and in knowing how to use testing data. Instrumental risks, awareness of the caution needed with X-rays and UV generating instruments, but not all institutions will have internal safety staff, and museum staff may be on their own to implement safe practice, training, and monitoring.
Quick question, Maria, that came in the chat, just from all the risks that you shared. Are you able to comment on whether mercury salts are being used in the preservation of the furs and preserved animals, just like mercury was used previously in the hat industry?
Yes, yeah, good, very good point. Yeah, exactly. So whenever we have like in costume collections and then in taxidermy, there's that risk. So yeah, mercury, a lot of heavy metals. People used heavy metals to bulk up the weight of silk sometimes too, so you could basically get more money for it because it was heavier. But yeah, whenever we see fur, like a fur trim on a costume, whenever someone is working with a taxidermy collection, we know those are hazards to pay attention to.
Okay. Thank you so much.
Yeah. So I want to go into detail on one risk type, just it's the one I know the most about. But there's also a building interest in our community on this, and there's indeed a very cogent need to respond to this responsibly within the vein of repatriation. Many types of art historical collections are susceptible to pest damage. Predominantly, historically, common sense measures were employed in protecting collections, ones which use mechanical methods or biology rather than chemistry, which emphasize prevention rather than cure. The museum field is returning to these safer practices now increasingly, especially since the late 1980s. We monitor and clean our areas to prevent pest intrusion. We preventatively treat for pests using freezing and anoxic procedures, so using oxygen-free environments. And these leave no residues and are more effective than chemical measures. So the top right is our big collections freezer at one of our centers. The bottom right is an anoxic system. So it's a bubble in which we pump humidify nitrogen in and evacuate oxygen out. And this kills pests as well. But for a long time, chemicals were used to control and eliminate pests around collections. So the earliest use of chemicals to kind of protect valuable objects was, in ancient Sumer, they used sulfur. China, as far back as 1200 BC, they were using arsenic and mercury compounds. The ancient Greeks also used sulfur. In the 17th and 18th centuries, there was the use of plants like tobacco, herbs, and arsenic. Those were commonly used to protect, material cultural value. In the 19th century, with the industrial age, there was a greater interest in inorganic chemical pesticides containing arsenic, copper, and sulfur. And in the 1940s, the modern era of synthetic pesticides began with the discovery of DDT and other chemicals like lindane and aldrin, and then use of chemicals and chemical warfare, World War I and World War II made things boom again. Practices used in the agricultural control of pests were adopted by collectors and museums. Pesticides were applied proximate to or directly on collections objects in liquid or solid form or in volatile form, often leaving residues. Pioneers in the field of museum health and safety in the late 1980s and 90s sounded the alarm, but it's been hard to sustain such efforts. In recent years, building use of portable X-ray fluorescence instruments, spectrometers adopted from other industries, are helping museum staff identify elements which indicate inorganic pesticide use. The presence of arsenic, mercury, lead on objects which do not include such metals in their original fabrication. This is increasingly a subject of conference talks and building online resources. Here are a few specific entities who are helping build this focus in our field. Some groups are sharing information and educating others. Others are directing collaborative projects. Others serve as ad hoc community forums to discuss concerns. AIHA, so the American Industrial Hygienists Association, has a specifically focused working group on the topic of museum risk. There's a repatriation-focused museum working group. This is the Contamination and Pesticides Repatriation Group. And they have a subgroup of X-ray fluorescence spectrometry users that are working to standardize practice. So we use this to test for inorganic residues on objects. There's a DIS list for librarians working with rare book collections, which contain book bindings colored with heavy metals. So this was a Victorian and Edwardian practice where they would use arsenic, lead, chromium to create vibrantly or kind of earth metal colored book bindings. It was very in vogue to have these like beautiful emerald green book bindings, but they were colored with arsenic. And as the book bindings break down, they can pose a risk. There is an affiliated project at the University of Delaware. That's the Poison Book Project looking into this. Our Conservation National Working Group is AIC, the American Institute for Conservation. They're organizing efforts as well, including pending safety courses. And then the foundational arm of AIC, they do fundraising and community support. They have a Connecting to Collections Care group that's put on educational webinars on many topics, but lately covering pesticide concerns. So we're all trying to do our part and trying to make these efforts cohesive as well. Tribal museums and collections are organizing efforts as well to advocate for each other and build safe practice internally, driven by their own needs. On the left, the an Indigenous Collections Care Guide is being developed collaboratively by tribal community representatives and museum professionals. It'll be released in the fall of this year, and it's funded by an IMLS grant. Its aim is to provide a framework to respect and recenter collection stewardship practices around the needs and knowledge of Indigenous community members. On the right are two presentations at the recent Association of Tribal Archives, Libraries, and Museums conference on the topic of managing pesticide risk. This conference is called ATOM. It's a fantastic conference to attend as well. But there were, at the most recent one in October, several presentations on the topic of pesticide safety. There are also collaborative efforts underway at different museums to try to quantify the level of pesticide residues present on objects in order to provide community members accessing museum collections or receiving repatriated objects back more information on exposure risk. So there's some amazing work being done in Canada. They're always leading the way. There's a entity called the Canadian Conservation Institute, CCI, and one of their scientists is leading some really amazing work in being able to not only test collections that are being repatriated, but also working with an external environmental consultancy to establish exposure levels. So that way they're getting community members that are going to, receive these objects coming back and interact with them, specifics on what, heavy metal presence there is and at what levels on each object, so they can make informed decisions. On the right, the Smithsonian's National Museum of American Indian is doing some fantastic work as well. They're working to test collections as well and build up standards to, again, find out quantifiable levels of inorganic residues on their objects and then to be able to report that back to communities in a way that makes sense, that isn't just sort of this confusing, test report, but something that has a narrative that makes sense, that is easy to digest and understand. Because a lot of these things, even with a chemistry background, I can't understand these reports. So these are some pretty significant efforts here from these institutions. Also, there are tribal community-driven testing efforts as well, such as a variety of projects being undertaken, at out in California. There's a collections professional, Melody McAdams, who leads one of the working groups that I referenced earlier. She's been doing a lot of testing work in her community. She's in Central California, the Auburn Indian community, to test their objects and then to increasingly advocate for other tribal entities as well. On the right is a group out in Colorado. This is a kind of a group of private conservator and private practice, an environmental consultancy, and they work to develop these series of 4 pamphlets to give people in small museums, people at tribal nations, tribal museums, or really anybody, a methodology to follow to swab objects themselves and then find partners in private labs to send off samples to get results as well. So it's really kind of a mix of efforts. One case of an institution moving to mitigate risk is our museum. So 3 years ago, we began to assess risk in our museum and moved to manage it. We tested our multiple collections, our main exhibited collection, but also our education collection, which is used in public demonstrations. Also, the rare book collection of our library, testing the bindings for heavy metal colorants. In-house, we're only able to test at the elemental, not compound level, for inorganic pesticides. Arsenic, mercury, lead is what we're looking for. And this is the tool we use, our X-ray fluorescence spectrometer. We partnered with our university's health and safety department and OSHA via Virginia's Occupational Safety and Health Department to test our workplace. So we tested the surfaces of our treatment and work tables, which come directly in contact with the collection's objects. And we tested surfaces in less direct contact, storage shelving, drawers, the top of transit carts. We also tested more removed surfaces, common touch surfaces like the keyboards of personal and shared computers, door handles, floors, even the break room. Personnel's breathing spaces were also tested while they went about their normal workday. And our OEHS partners educated us in the hierarchy of controls, and we implemented controls custom to our workplace, taking better advantage of installed air extraction systems, attempting to increase hand washing access, more formalization in cleaning routines, and segregating electronics, personal items, documentation tools, which are moved around the facility from the surfaces that the collection's objects are on. Also making sure PPE is always to hand and plentiful as our cleaning materials to remove barriers to compliance. Also signage to draw attention and reinforce safe practice. The sign on the left prompts us to clean the door handles 3 times a day. It's really simple, but that has actually transformed our safe practice. We label tested objects as well, and we document in centralized locations information on tested objects. So the bottom right is our collections database, where if we found a hazard, we document that where other people can later find it. We're standardizing PPE usage and training on donning and doffing as well. Our University Health and Safety Department helped us throughout, but we also accessed free consultation and testing services from OSHA via their state partners, in our case, via Virginia Occupational Safety and Health. And that's through OSHA's on-site consultation program, which is a fantastic free resource. They test locations, they give you advice on building safe practices, they come in and review your facility as well. They've been fantastic partners. They guided us in developing a formal health and safety plan. And our health and safety plan covers physical risk and chemical and instrumental risk. And we've begun training staff on this document. We've also begun sharing what we've learned to guide others. So we've organized a series of case study presentations of museums and tribal representatives attempting to build similar safety practice. And the Johns Hopkins ERC has been our partner in this series. So last year we did a 6-month series, and then I'm trying to extend it a little bit into this year. QR code if you guys want to check it out. But if any toxicologists are interested in presenting or learning more, please reach out and let me know, as I'm trying to really increase the pairing of people in tribal entities and museums having access to industrial hygienists, toxicologists, occupational physicians. Um, Based on our work too, our museum is trying to create an abbreviated guide on how to build a safety program. We're currently in an early draft phase, and we're presenting on this topic at conferences to get input, such as the conference at the bottom right, where we presented a couple weeks ago. But we're going to a wider museum conference in May as well, and having a roundtable to have people view our safety plan and our little guide and get feedback. So we're trying to bring different communities together to get input and make sure that whatever we put out is digestible by everybody. We've benefited greatly by getting to know OEHS professionals, first industrial hygienists, subsequently epidemiologists, but we're learning that a full safety response requires a multidisciplinary team, and we really would benefit from the expertise of toxicologists and occupational physicians as well. So if you have any interest in supporting our communities, there are many ways to learn more, and I listed some at the right, but you can also reach out to me. Or if you want to partner with us, we're realizing we need sort of like a superhero team that is different people from different backgrounds. And we have collection-centric people and industrial hygienists, but we also need an epidemiologist, and we need a toxicologist, and we need an occupational physician. So really helping us build our dream team would be most appreciated. And that's it for me. I just wanted to, leave some contact information in case anyone has further questions or wants to engage with the museum community or tribal communities. I can maybe point you in good directions. But mostly just thank you very much for listening to me speak today. I appreciate the chance to listen to your presentations as well.
Thank you. Thank you so much, Maria, for an outstanding presentation on such a important topic and for increasing our awareness as well. That's amazing. Just right away, we have a comment in the chat saying in terms of whether you would be able to speak to biological hazards, if any, that I wonder if there's a problem in terms of damaged material restoration.
Oh yeah. So biological hazards, I guess would you mean like sort of like mold and fungus and things like that?
Could be part of it, yes.
Okay. Yeah. Gosh, I'm trying to think. I mean, certainly archaeological conservators, there's sometimes waterlogged collections that you look, there's a whole subgroup of people that work with like marine extractions, sort of, submerged, damaged ships,
Right.
excavating those materials. And there's a lot of things that are waterlogged that you keep in a waterlogged state as you desalinate them and process them. There are people that work with I would say too, a lot of archaeological materials some of them come from a burial context as well. So that's a factor too to think of. I'm not as versed or experienced in a biological realm, though I would love to be because biology is more my background.
Right.
But yeah, we tend to go right to the chemical risk, and we have, I guess, a little less, at least in my field, I'm a textile conservator, kind of a little less engagement with the biological risk. That this might not be the case for other conservators.
Yes.
Mold is, yeah.
Excellent.
Anthrax and hides. Yeah, I've wondered about this myself. I think there have been some people that have worked with collections out west, which have a lot of hides in their collections that I've heard mention of concern about anthrax. Mold is always an issue too. Yeah, it's a very good one to bring up. And we occasionally, a lot of people nowadays, we try to store collections in environments where mold is not going to develop, but sometimes you still do encounter it on a recently accessioned item. And so that is a hazard that we do try to address and test for. For instance, we received a Japanese theatrical costume from the 18th century and has some staining on it that looks a little bit like mold staining. So we've isolated it. We're working with an environmental consultancy to try to swab and test to see if this is mold, is this an active culture? So it does touch in a little bit, but I admit the chemical stuff kind of blinds us usually, and we're maybe a little less thinking about biology at times.
Mm, Looks like there's a question in the chat too about examples of cases of people who suffered from chemical, I guess, chemical toxicology related to their work with antiquities.
Yeah. Well, I mean, a lot of us wonder. I know we have what happens to us when we do have a reaction to an object more um, in the acute stage, I would say. We'll have dermal reactions, we'll get rashes, we may get headaches, we may feel nauseous. One of my staff before has had like a metallic taste in her mouth when she's worked with some objects. The stinging in the eye is the first time I've encountered that recently, but we do get a lot of rashes. Since we employed our safety program, though, we've only had one reaction, and that was mine recently. So what we're noticing is with using the PPE properly, we're not having these reactions with kind of more isolated practices with new unknown things coming in. We're mitigating that a lot. But that's what happens in the more, I would say, present stage. But there is a lot of concern and question about what happens in a longer term stage. Do we have a higher risk of cancer? Do we have a higher risk of neurological disease? And I know there is concern and anxiety about that in our community. And some of our health and safety oriented subgroups are trying to look at just even the anxiety related to that, but trying to address some of those concerns. But we could always use more help in establishing and studying the long-term effects. I mean, what comforts me is the fact that at our institution, we have a lot of people that did not wear gloves in the past because it wasn't a practice, didn't use PPE, and they've lived to ripe old ages and not had issues. But I think, the human biology is very complex, and what may be a hazard for one is not for another. People react differently. So that is definitely something that I know we all have a concern in the back of our heads about. And I worry too. I think a lot of us have felt kind of anger and frustration with not being educated more on this earlier. And going home and picking up our kids, hugging them and wondering if we transfer contaminants. So we've really worked hard at our institution to really up our PPE and our cleaning such that we're not transferring contaminants. But yeah, the longer term risk is definitely on our minds.
Well, thank you, Maria.
Yeah.
Please feel free to either place question in the chat or unmute / raise your hand. I can recognize you that way too.
I have a comment and a question.
Yes.
We've got windstorms here in Baltimore. I'm just waiting for my bandwidth to drop at any moment. But Maria, thank you. It's just I'm so impressed with how much of a champion you've become and just advocating for your entire industry, really. Just for context for the group, the 6 session, seminar series that Maria's hosted, is well over 1,000 attendees. The ERC had to purchase a higher tier Zoom license as well as more of our CVent registration platforms to accommodate it. It's wildly popular and well welcomed. So thank you for that, Maria. Just to see this happen, it's been an honor. I've been curious because I have to use XRF, X-ray fluorescence, a bit in my labs, just doing like IH particulate filter monitoring, for metals. How has the dosimetry program been panning out just in, your immediate vicinity with tracking exposure to, XRF?
Yeah. So like how have we used that in our practice or?
Your dosimetry monitoring. Do you have a dosimetry monitoring program that accommodates that?
We
Like
do. We
your
do.
rings?
Yeah. Luckily, being with a university, we have a lot of safety nets now. And so we do have badges we wear when we're using XRF. Those are collected every quarter and sent off and analyzed. We have no exposure to the X-rays as of yet. And then we do annual training as well, like laser and radiation training with the university too.
Okay.
But that's a bit more uncommon. Not a lot of museums will have that institutional support.
Right.
Yeah,
Right. So
yeah,
it was surprising to me to learn not just how often XRF's utilized in conservation museum.
yeah. It's become very in vogue, and there was one conservation scientist made probably like 10, 15, 20 years ago that started, you know, instrumental tools are not developed for our industry because we're not for profit. We just don't drive that, but we borrow from other industries. And so he kind of got everyone in the museum community aware of this instrumental tool. And it's really becoming pretty popular to try to fundraise to acquire one of these instruments, but they're expensive. You know, they're $50,000 at minimum, if not more. And so people are trying as well to kind of pool resources and share a tool, rent a tool. Um, but again, you may not always have that safety structure to know how to monitor while you're using it or train on its use.
I mean, just largely being nonprofit entities, that adds another layer of just the difficulty in having organized, EHS approach to exposures and understanding that, as well as in the occupational medicine support. Because, nonprofits, everybody's wearing 5 or 6 different hats, right? I work with all nonprofits for a living, in NECOEM, MARCOEM, everybody wears a lot of hats. And so having to be a jack of all trades, but master of none makes an added layer of difficulty in organizing such a concise approach to this.
Yeah, no, it's a very good point. And some of our professional working groups are trying to address that. So we our professional working group in the Americas, the AIC, the American Institute for Conservation, they're trying to develop lab safety courses to look at that, to like, kind of train people and make sure they understand the risk from the instruments as well as the risk from objects, and maybe get people certifications and safer use and kind of pool resources. But yeah.
Well, it's wonderful to hear from you again. Thank you.
Oh, thank you.
I think related to that question, Maria, another comment in the chat too of that do we have an understanding of what's happening overseas to deal with this issue? I know you mentioned in your presentation like Canada and other places, that they're helping with certain aspects of this, and just wondering if they've set any precedents for this problem, like the comment in the chat mentioned about the Louvre in France, like how things like that.
Yeah, I'm just starting to learn about that. I don't know if specific work being done in France, but I'm sure it is. But folks in Belgium and the Netherlands are real leaders, and Germany.
Wow.
So they've been really leading the way over in Europe as well. And there was a conference organized called Hazardous Heritage in Antwerp in Belgium a couple years ago. Um, and I'm starting to learn more about, Dutch colleagues and Belgian colleagues as well. We've had one or two of them present so far in our series, and I'm trying to extend it a little bit. Finland as well. There's a very, very impressive museum professional there. She was a curator, but then she got her PhD in, I think, environmental and occupational safety, I think. And
Yeah.
she built a whole safety program related to collections for Finnish museums. So there's a lot of leadership in Europe, and I'd say a lot of leadership in Canada. And I'm sure there's leadership elsewhere, but we're so siloed often. We're doing the same things. We're dealing with the same, chemistry, the chemical risk, we're dealing with the same biology. We're all human. We're maybe dealing with different legislative practices and resources, but really we have a lot of commonality. So I think a lot of us are trying to come together to help each other out a lot more lately.
Oh, interesting. So hopefully, yeah, there's more collaborative efforts, and as Susan mentioned in the chat, having international conferences on this.
Exactly. I mean, there's got to be great work going on in Korea and Japan and China,
Yeah.
in Singapore and Australia, New Zealand. So I just really want to. That was the point of our series, was international, to bring people together, so we're not reinventing the wheel all over the place.
Right.
Yeah.
Um, And I guess a question that comes to my mind too, you kind of mentioned in the presentation, is in terms of those museums that are smaller, kind of more local museums, trying to see what kind of support they can get, because I know that, like you said, the level of training and awareness of even the risks and of course the local resources, it can vary depending on that too.
Yes, yeah. And when you're like underfunded and, as Chris said, wearing many hats, you may be concerned about something, but then you're distracted on the next emergency and the next emergency. So getting that
Right.
momentum to get safer practices, it's tough, so the more we can share and save people time and effort, the better.
Right. Thank you. Other questions, please feel free to place in the chat or unmute too, either way.
And I see one, it sounds like there should be an international conference on this.
Yeah,
There,
yeah.
there's a collections professional in, I think she's in the Netherlands that's working on something like this. So maybe, similar to the Hazardous Heritage Conference. So, if anyone's interested in engaging more on these topics with the museum community, just let me know, and I can try to keep you aware of things that are coming up.
Wow. Mm. And the safety program that you created, Maria, just asking, like, how often do you kind of have that reviewed every couple of years or every year, kind of a brief review?
Yeah, our plan was to annually go back and look at our health and safety plan. There's a couple sections we're still working to finalize. But whenever we have new staff come in that are collections oriented, I train them on those documents. So it's kind of a moment to review and refresh. And
Right.
each time I may find something to update. So it's in effect getting looked at 3 to 4 times a year. And then we're just now getting it up on its feet such that we can annually retrain staff, and annually review it as well for updates.
Right.
Yeah.
Okay. Awesome. Um, Other questions from, yeah, you can feel free to place in the chat or unmute, either way.
I mean, I would love too to hear from you guys. How can I better engage with the toxicology community? Like if I wanted to look for resources, if we needed a consultation, if we needed advice, where would I go? That's a question I would love to ask because we do want to keep adding people to our dream team, and we realize we need not just industrial hygienist, epidemiologist. There's a lot of different subspecialties in the OHS world.
Hmm. Yes, yes, Dr. Goldman.
I think that's a good question. I thought this was fascinating, and we all have museums around. I think if you wanted to reach out, I think the various ACOM, NECOM groups, there are lists of people and their contact information. In addition, I'm a member of the ACMT, the American College of Medical Toxicology. So if you had a specific question about that, they also have a list of consultants on their website or members. Some of them, are more into drug overdoses, but there is a subset of those of us in ACMT that are more interested in pesticides, biological agents, a bunch of things like that. So that may be another group to reach out to.
Wonderful. Thank you, Dr. Goldman. I really loved your presentation. Thanks.
Thank you. I loved yours too. It's always great to hear about another work site. Years ago, when I first started out, I was dealing with the aquarium who was building this artificial reef inside that was actually had a lot of pesticides and solvents. I mean, not pesticides, solvents. So we had to monitor the workers for that. So it's very interesting and makes me wonder about what's going on at the MFA, or so I might reach out to them.
Yeah.
Yes. And I can also see a connection, Maria, with you and Dr. Goldman in terms, I know, Dr. Goldman, you have that, involvement with the pediatric environmental health side and with museums, kids museums, they may, play with the fur things, things that are having to be preserved. So there's that connection as well. And another question in the chat, Maria, that came in is there sort of a hierarchy of, in terms of risk profile, like highest risk exposures versus lower risk exposures in your industry, kind of a separation there?
Um, Not that I know of. I don't know if I wouldn't say been that organized, but known to apply this level of organization. I think, not that I'm aware of.
Okay. Okay.
Yeah, not that I'm aware of. But this
Um,
could be, yeah, as we're working to kind of build up and share resources and standardize practice and a safety approach. That's good to know that these are concepts that might exist, that listing, I guess subsections of like professional, I don't know, is a conservator more exposed than a curator or something like that?
Right,
Or if you're
right,
working with
right.
this collection, are you more exposed in
Mhm.
that collection?
Right,
I
right.
think we know this all kind of loosely and in a narrative format, but to be able to, quantify that and you know, I've never thought of that level of organization, but that's interesting.
Mhm. Yes.
A lot of this is so new to us. We're such newbies in thinking of these approaches and terms that we're not often aware of these really standard concepts in the safety community. This is helpful for me.
I see, I see. Okay.
Yeah.
And that was helpful to see that your organization has a work within the industrial hygiene group. There's a subsection there. That was helpful to realize as well.
Yeah. They were very helpful to us. And I see this comment here about GW Employee Health Clinic.
Oh, funny.
Yeah, we've had good look. Another presentation I did, some occupational physicians approached me as well. So we're starting to learn what resources there might be within GW, but outside of GW locally as well, like in the Inova medical system. And if there's been kind of burgeoning internal GW efforts as well to look at kind of occupational risk as well from a biological perspective. So the fact that we are now part of a bigger university structure is really what has helped us a lot, I would say.
Mm,
Um,
I see. Well, great discussion so far. Other questions or comments? Okay, excellent.
and
Well, oh yes,
I'm sorry, can I ask one question? The toxicology group, I didn't write it down immediately. Was it ACMT?
ACMT, I
AC,
believe. Yes, American College
ACMT.
of Medical Toxicology.
Okay. Thank you so much.
Yeah, ACMT, American College of Medical Toxicology. Yeah, I've been actually encouraging them, but they've been trying to put in more about occupational and environmental exposures, and that's how I got in there as an adjunct member with that area of knowledge and teaching the toxicology fellows with that area because it is part of their training now. So they have people there. Interestingly enough, some of the people you asked about biological hazards, there's some people there that are really very keen on some of the biological toxins, rattlesnakes, that kind of thing. So I don't know if you have any of those kind of actual biological toxins that are left on that, but there are people with that kind of expertise as well.
Yeah. And there are some, our collections run the gamut from, osteological collections to natural history collections to, and yeah, venomous animals, preserved venomous animals and yeah, floral collections as well. There's some natural, plant collections and things like that. So yeah, the world is a chemical stew for sure.
Yes. Um, a quick related question I had, Maria, is that I know you're based with GW. Do you know if is there like a university collaborative, among these universities of higher education, like where maybe they have a sort of consortium that they talk about things like this together at the university level?
There's a group called Shishima. It's, I think, CSHEMA. And they're sort of environmental and occupational health oriented group for university kind of educational collections. Let me just make sure I'm.
This made me wonder. 'Cause I know many universities will have those collections either in their libraries or elsewhere.
Yeah. Shishima is the Campus Safety, Health, and Environmental Management Association. They're pretty active, and they recently signed MOU with our Conservation National Group, AIC, to try to build collaborations.
Okay.
So we're getting to know them a little better as well.
See, would you be able to place that in the chat, Maria?
Oh,
Just
yeah.
and then
Yeah.
I think we have time for one more question. So I think it's a really good one in the chat. Is kind of is there someone in charge of sort of overseeing, assessing kind of new systematic for new acquisitions for potential future exposures, like other new chemical, biologic, toxicologic hazards in your domain?
Yeah, good question. That's me at this point.
Okay,
We're working on
okay,
that. So what we
okay.
do is we test every time we have a group of objects that can be exhibited, we test them with our XRF for inorganic pesticide residues. But we're now starting to try to test for organics as well. And it's early stages. We're going to try to work with a local for-profit environmental firm. And then again, one of our newer health and safety colleagues that just joined the university has a PhD in analytical chemistry, so he's helping us as well. And we want to build up something where we can, at the least, test objects that we've had reactions to, but maybe at some point we have a screening process where as new things come in, we test them via these two methods. That's our hope and dream. But right now we're doing kind of random selections of our collection just via what's exhibited. Um, and we're building up a lot of analytical profiles that way. But really, you need a dedicated staff member for this, which is kind of the trick for us. So we're, you know, trying to also organize and fundraise to establish like a purely research position in my department. And that person could maybe take on something like this too. A lot of our barriers are just the fact that, again, we're wearing many hats and doing many jobs, and it's a lack of time to look at these things.
Right. Yes, Dr. Goldman.
Yeah, I have one other quick question about the XRF machine. I know we've had use of one to measure for lead, but I was very interested, maybe either you or Christopher could speak to it, about an XRF machine that's actually measuring for chemicals. That's very cool. Could you just say a little bit more about what it's actually measuring?
Yeah, the XRF as we use it.
Yeah.
We what we're tending to look for is lead, mercury, arsenic, chromium, and just qualitative identifications at this point. So we're just looking for presence, absence.
Okay.
Okay.
That we're going to try to work towards more quantification as other museums have been doing.
But you mentioned, was it can also measure pesticides? Because I thought, did I mishear you that it's detecting pesticides as well? Because I don't quite understand how that would work given the physics of the XRF, which is more reflecting off of metals. So could you just, you're using it for pesticides too?
Exactly. So we yeah, we're it's only as you guys know probably more than I do, it's elemental analysis, not compound level. So when we're detecting arsenic or lead or mercury, and that's not part of the making practice, we're kind of assuming that it must be a pesticide um, residue present. If arsenic wouldn't be used in the making of something, if it's just cotton, so it's like carbon and oxygen.
See.
If it has a paint or pigment on it, we might know certain, it might have copper on it, something like that from a pigment.
Okay, so you're measuring the arsenic and assuming that if there's arsenic there, it's related to an older used arsenical pesticide. So
Exactly.
you're not really speaking to organic pesticides of the kinds that would not have a metal with them.
Exactly. And that's
Okay,
the
that
trick
explains
is,
it for me
yeah,
then.
yeah. Sorry if I
Okay.
explained that clearly. So
Yeah,
when we're
no.
finding just arsenic or lead as an element, we don't know what compound that might be part of. We're assuming a bit. It might be from, a mercury compound pesticide, a arsenical compound inorganic pesticide. The organic pesticides, I think, were used just as ubiquitously. And at present, we don't have a easy way to test for this, but that's what we're trying
Well,
to do right now.
there's mercury that's in fungicides, and that are used to treat seeds and other things, and then there's arsenic in old ones. But lead, I think, would come more from the pigments. I mean, maybe somebody else knows. I don't know of a lead-related pesticide, but that's interesting. So you're making the assumptions from finding the metal and then assuming it came from one of those things. Interesting.
Yeah,
Okay.
exactly. And
Thanks
hopefully,
for that clarification.
oh, you're welcome. I mean, as we go on, hopefully we would be able to maybe identify at a compound level and then really reduce any assumption.
Yeah,
Um,
you're really bottlenecked by needing field, analytical capacity rather than because that needs to be non-destructive, right?
exactly.
So,
Yeah.
and
Yeah.
the organics, to my knowledge, are largely, field detection is with like VOCs. It needs to be a volatile organic compound. So you need
Yeah.
a photoionization detector, a PID. But that just, those are calibrated with isobutylene, so it's like this large umbrella of potential compounds that it could be. Um, but being limited by a non-destructive method is the really tough part in this situation.
Yeah.
Um,
Thank you for bringing that up because I was just thinking of it as obvious, but it's not. We're dealing with older objects, so we can't just sample from, in a cavalier fashion. We try to, as much as possible, not sample at all.
yeah, wow. Well, thank you so much, Maria, truly for a very outstanding presentation, very enlightening, I think, for all of us and eye-opening, and truly look forward to further collaborations. I think that's the spirit of all of this. So we really thank you for being here with us.
Thank you for listening and all the information. You've been very helpful to me. Thanks.